So welcome the back guys in this Zero to Hero series, and today we are going to discuss 11th and 12th cranial nerve. 11th, that is the accessory nerve, and 12th is the hypoglossal nerve. Okay, so one by one we will discuss it. So so far we have covered that third, fourth, sixth cranial nerve and ninth cranial nerve also we have covered so far. Okay, and what is the basics thing which you have to know? That is the basics concept of cranial nerve. That video you have to watch it. Okay, and you should be thorough with the basics concept. If you know the basic concept, it means you know 50% of the cranial nerve, right? And you can write easily without reading anything. You can write. Yes, if you are thorough with the basics concept. Okay, which I already covered in the basics concept of the cranial nerve. Okay, so today we are going to see the accessory nerve, and that is the number 11th cranial nerve. 11th, right? One student asked me one question, sir, whether there is one term that is called cranial accessory nerve and where one is the spinal accessory nerve, whether this both are same or not. Like that he asked me. Okay, what do you think, whether it is same or not? See, whenever we are telling no, we are telling cranial root of accessory nerve or spinal root of accessory nerve. See, this nerve is having two roots. Okay, I will explain everything. First of all, you tell me whether it is sensory, motor or mixed type. 11th cranial nerve, so it's the motor only, no? Yes, so this is the motor type. Motor type. Okay, you know which is the sensory, motor and the mixed cranial nerve, right? This is the motor. Now this accessory nerve is it has two roots. Yes, it has two roots. One is the cranial root. Cranial root, and second is the spinal root. Cranial root and the spinal root. So what is the origin of the accessory nerve? Have you watched the video on the glossopharyngeal nerve? You have to watch that video, because in that video already I have explained that 9th, 10th, 11th and 12th, these last four cranial nerves are closely related with each other, and I told that from where 9th nerve arises, 10th, 11th and 12th. Okay, everything I have discussed, but okay, let me draw again. Okay, so the thing is, like, this is the midline, right? And here is one, this is pyramid, and something is this, that is the olive, right? So this is the P means pyramid and O means, let me write, this is olive, right? So can you tell me the nerves, 9th cranial nerves from here only? One thing is this, second thing is this, and third thing is this, right? And one thing that is this. So actually what, this is the 9th cranial nerve, 9th, this is the 10th, and this is the 11th, and this is the 12th cranial nerve. So can I tell 9th, 10th, 11th cranial nerves arise from the lateral to the olive? Yeah, this all from the lateral to the olive. Is it? Yeah. And 12th cranial nerve which arise from between the pyramid and the olive. You can tell lateral to the pyramids, no problem. You can tell between the pyramid and the olive. So 12th cranial nerve. See here, because after this we are going to discuss only 12th cranial nerve only. Okay, so it's 12th cranial nerve arises between the pyramid and the olive. Now we are discussing 11th cranial nerve, so it's arises from the lateral to the olive. Lateral to the olive. So see here, it has two roots, cranial and spinal root. So spinal root means spinal nerve, right? So this spinal nerve arising from where? Obviously from the spinal cord. Yes, so from the spinal cord, and this from where? Can you tell me? Cranial root from where? See, lateral to the olive. Yeah, so lateral to the olive. So what is the origin point of the cranial nerve 11th? You have to tell it has two roots. One is the spinal root which arises from the spinal segment, which, yeah, first 5 cervical vertebrae, right? From there, and the cranial root, you know that things, from the lateral to the olives. Okay, so this is the origin point. what actually happened, here is this is the 11th now, right? So this is the cranial part and it's going like this. Am I right? Yes. So if it is your medulla oblongata, this thing is your medulla oblongata, then obviously this part is your spinal cord. Am I right or not? Yes, this part is your spinal cord. Yes. Now, from spinal cord, what actually happened, these things, let me draw more clear. So, these things. These are the spinal now. Yeah, these are the spinal now. Now, this is arrives from the spinal cord. Yeah. And we are talking about cranial now. It means it should enter into the cranial part. Yes. So, from where it will enter into the cranial part? See here. If this is the spinal cord and this is the medulla oblongata, then obviously here is one foramen and that is called what? Foramen magnum. Foramen magnum. So, spinal cord, spinal root of this accessory now, after origins from the spinal cord, it's enter into the cranial cavity. It's enter into the cranial cavity through foramen magnum. Through this foramen magnum, and it will join to the cranial root. It will join the cranial roots and it's come out from where? Already I have explained in the 9th cranial nerve that it's come out from where? Jugular foramen. Okay, so there will be one foramen. See here. 1 minute. I'm sorry. So here is one foramen, right? And that is called jugular foramen. Yeah, jugular foramen. And see, it's this spinal root and cranial roots. It's joining it just before this foramen, jugular foramen, and it's come out. And after this, it's getting separate, right? So this is the spinal root. Yeah, this is spinal root, and here is the cranial root. Right? Here is the cranial root. Now, here is the cranial root. Okay. Yeah. Now, what actually happened? Here is the 10th cranial nerve. So, this 10th cranial nerve will come down. Yeah. It will come down and it come out from the cranial cavity through same only jugular foramen, and here is the superior ganglion and here is the inferior ganglion. Right? So this now cranial root of accessory now it's joined this inferior ganglion, right? Here it joined this inferior ganglion and it's supplying to which structures? Muscles of the larynx, muscles of the pharynx, right? So this part is supplying to the muscles of the larynx and the pharynx through 10th cranial nerve, right? And this is the what? This is the spinal root, right? See here. This is the spinal root and it's supplying to the which structures? To S and T. What is S? S means sternocleidomastoid muscles. Sternocleidomastoid muscles and T means trapezius. Right? So sternocleidomastoid muscles and the trapezius, right? So what you have to remember, see, 11th nerve is the very simple. Okay, it has two roots. Only one is the spinal root and second is the cranial root. Right? So cranial nerve from the lateral to the olive and spinal root from the spinal segment. First 5 cervical segments, and this spinal root will, this spinal nerve, it will enter to the cranial cavity through this foramen OL. Yeah, obviously. And after that it's joining to the cranial root and it's come out through the jugular foramen. Am I right? Yes, and from here, these two roots getting separate. One is joining to the vagus nerve. Vagus, right? 10th cranial nerve, which we will cover, no problem. And the second is the spinal root, which is supplying to the where? Tell me. Yes, sternocleidomastoid muscles and the trapezius, right? So this is the thing which you have to remember in this 11th cranial nerve, right? So now you tell me one thing. One thing you tell me. What about your favorite topic? That is the functional column. Can you tell me the functional column of the 11th cranial nerve? If you tell, I will be very happy. Okay, because maximum students, I I don't know whether they are able to write or not, okay, but it's very simple. You have to think, okay, functional column, functional component, right, or functional columns. Tell me, do you know, see, one thing I am going to write here, one thing is the general, one thing, general somatic efferent, and second thing is the special visceral efferent. Think special visceral efferent. I think you having problem that why I am writing these two fibers without explaining. Do you know? See, general somatic efferent. The moment you think general somatic efferent, what should come in your mind? Oh, this is the fibers which supply to the muscles which arise from the where? Yeah, very good. From the somites. Oh, so occipital somites and the preoccipital somites. Oh, so muscles of the tongue or extraocular muscles. So extraocular muscles already we have finished. What is the nerve supply of the tongue? See, we are talking about 11th cranial nerve and that is the motor. Okay, so we have to know the motor supply of the tongue. Yeah, all the muscles of the tongues are supplied by hypoglossal nerve. Oh, so this fiber will be present in the hypoglossal nerve. Yeah, obviously. Then why I wrote here? That is the thing. So see, all the muscles of the tongues are supplied by hypoglossal nerve. No problem. I will write this fiber there in the hypoglossal. On that time you should not have any problem. Okay, but why am I writing it here? What is the nerve supply of the completed nerve supply of the tongues? All the muscles of the tongue are supplied by hypoglossal except palatoglossus, which is supplied by tell me, yeah, which is supplied by cranial root of accessory nerve via pharyngeal plexus. So it means there is one exception. Okay, the palatoglossus, that is the also muscles of the tongue only. No, so muscles of the tongue arise from where? Somites, right? So which fiber will be there? General somatic efferent fiber. I think you got it. In the 12th cranial nerve, I know tongue, muscles of the tongue supplied by 12th cranial nerve, no problem. But there is palatoglossus, which is supplied by this 11th cranial nerve, and we are reading this 11th cranial nerve. So ultimately, 11th and 12th cranial nerve both are supplying the muscles of the tongue. So only I wrote here general somatic efferent fiber. Got it? Yeah. Tell me why special visceral efferent fiber is there? The moment you think special visceral efferent fiber, what should come in your mind? I repeat it thousands times. Okay, and now I know you remember. The pharyngeal arch should come. Right? And what is the nerve for the pharyngeal arch? Okay, mandible. I mean mandibular nerve, facial nerve. Yeah, glossopharyngeal, superior laryngeal, inferior laryngeal. Hey, there is not 11th cranial nerve. Then why I wrote here? You tell me structure which arises from the 4th pharyngeal arch. Oh, that is the what? Muscles of the pharynx. See, pharynx is here, larynx is here. Okay, so remember, 4th structure which arises from the 4th pharyngeal arch. That is the muscles of the pharynx. And after that, muscles of the larynx, right? Larynx is somewhat down. So, larynx. So, this is from the 6th pharyngeal arch. So, pharyngeal arch, which? 4th and the 6th. There is the muscles of the pharynx and the intrinsic muscles of the larynx, right? So, see here. This is the which nerve? Tell me, yes. This nerve is the 10th nerve. This is the 10th nerve, right? So, this is the 10th nerve. Am I right or not? Yes. So, it joins the 10th nerve and it's supplying to the muscles of the pharynx. Yeah, and intrinsic muscles of the larynx through this 10th cranial nerve. So, ultimately, the 10th cranial nerve, which kind of fiber it having? 10th cranial nerve, superior laryngeal nerve and inferior laryngeal nerve. Oh, so this fiber only, no, specific visceral efferent fiber in the 10th cranial nerve, because there is the superior laryngeal nerve and the inferior laryngeal nerve, which is ultimate branch of the vagus only. So here is vagus and it's joined the vagus and it's supplying to the muscles of the pharynx and the larynx, which is arise from the pharyngeal arch. That's why I wrote here special visceral efferent fiber. I think you don't have any problem in this concept. Got it? Yes. So functional component is here. Two parts, cranial and spinal nerve, 11th motor, and this is how you have to remember. Like spinal, if nerve is arising from the spinal cord, okay, obviously it and if that is the cranial nerve, I'm talking about cranial nerve, right? So it has to pass from foramen magnum and it will join and it will come from the jugular foramen. Okay, so this is the things which you have to understand in the 11th cranial nerve, which is the very simplest. Okay, very simple. Okay, okay. Let me rough this diagram, and now we are going to start only last cranial nerve, that is the 12th cranial nerve, and that is the hypoglossal nerve, 12th cranial nerve. Can you tell me the motors, whether it is motor, sensory or the mixed? Yeah. Can you tell me the functional fiber for it? Yeah, very good. Yeah, tell me. 12th cranial nerve, right? So here is the one thing that 12th cranial nerve we are talking. 12th cranial nerve, and that is the hypoglossal nerve. Yeah, hypoglossal nerve. Tell me whether it is sensory, motor or mixed. Yeah, very good. It's motor only. It is motor only, not mixed. Mixed means 5, 7, 9 and 10. Okay, so this is the motor. Now tell me the course of this. Okay, we will talk it later, no problem. It's supplied to the which structures? 12th cranial, hypoglossal nerve. Oh, just now we have seen, no, that all the muscles of the tongue are supplied by hypoglossal nerve, right? So it's supplied to the muscles of tongue. Am I right? And if it is supplied to the muscles of the tongue, it means muscles of the tongue are from the somites. So which kind of fiber this now having? Yeah, that is the general somatics arising from the somatic. Okay, somites. So only general somatic efferent fiber. So here is the functional column. Okay, I want to functional column in this. Which kind of fiber is there? That is the general. Yeah, general somatic, and this here is the efferent. Do you have any problem in this? I don't think so, right? So general somatic efferent fibers is there. Have you read this 12th cranial nerve anywhere others? No, it's supplying only the muscles of the tongue. Okay, so only one type of fibers is there. Okay, so this is the things. Now can you tell me its origins? Yeah, just now we have seen it's arise from the lateral to the or you can tell between the pyramid and the olive, right? Only, no? Yeah, see here, already I have discussed this thing. See here, this is, it's arising from here only, no? From here, yeah, from here only, and this is this is the pyramid, and here is the olive. Yes, it's come out from cranial cavity through jugular foramen or the hypoglossal canal. Yeah, hypoglossal. No, so hypoglossal canal. You remember like this. Here is one canal. Here is one canal, and that is called hypoglossal canal. Hypoglossal canal. HC, hypoglossal canal. Right? So it's come out from here. Remember one thing: 9th, 10th, and 11th cranial nerve from the jugular foramen, and 12th from the hypoglossal canal. Okay, remember these things. Origin, you know from where it's getting origin. Okay, if you know the origin and if you know from where it coming out, it means you know some things. Okay, and after that functional column is your favorite topic, so you can write about functional column also and supply to which structures I have told you. Okay, many times, so you remember. Okay, so you can write everything about that. Okay, so from here, and this come out from the hypoglossal canal. Have you seen video on the hypoglossal, that glossopharyngeal nerve? See, you watch that video. I have discussed basics there. Okay, but it's okay. Let me discuss basics again here, right? So the thing is, here I just want to wrap this part. So see here, this is what? This is the jugular foramen. Am I right? And this is what? Hypoglossal canal. Okay, so let me mark. This is the hypoglossal canal, and this is the jugular foramen. Okay, jugular foramen. Okay, jugular foramen, right? Now, what actually happened? Here is the internal jugular vein. Internal jugular vein. Okay, everything I have discussed in the glossopharyngeal now, but it's okay, right? And here is we have an external carotid artery, and sorry, this is the internal carotid artery, and here is the external carotid artery, and here is the loop of the lingual artery, and this is the common carotid artery. So actually, what happened? Just now I discussed the 11th cranial nerve. Okay, first of all, I want to discuss this 12th cranial nerve. I am showing with the black mark. It's come out from the hypoglossal canal. Okay, it runs medial to this internal jugular vein. Okay, you should not remember it. Okay, no problem. After that, it's crossed the. This is what? This is the internal carotid artery, and here is this is the external carotid artery. So it's crossed, or you can tell it's crossed anterior to the internal carotid artery and external carotid artery, and also loop of the lingual canal. Sorry, lingual artery. So here is this is the loop of lingual artery. Okay, can you tell me what is there after that? See, here is the external carotid artery and loop of lingual artery means lingual means supplying to the tongue only, no? So somewhat here is the tongue. Somewhat here is the tongue. Am I right or not? Yeah, obviously. Here is the tongue. Now it, and what is the nerve supply of the, it's supplying to which structure? Tongue only, no? So it will supply to the tongue. Yeah, now maybe there one thing that is whether it is superficial to the hypoglossal or hypoglossal muscles or the deep to that. See, this is the submandibular gland, no? Yeah, this is only submandibular gland. The moment you think submandibular gland, yeah, I'm giving you 5 seconds. Okay, think about submandibular gland. What can you think? Yeah, it has 2 parts, superficial and the deep part. In between, see, that's why I'm telling. This is the exact position, exact shape of the submandibular gland. This is the superficial part. This is the deep part. In between one muscles, and here is the one muscle. In between one muscle means mylohyoid is there, and after that here is the hypoglossal muscles is there. So it runs superficially to the hypoglossal muscles. Can I tell this? Yeah. So hypoglossal muscles will be here. Here will be the one muscles, and that is called hypoglossal muscles. Okay, I think it's visible. Right? Here is the hypoglossal muscle. Now, so this is the course of the 12th cranial nerve. Yeah, can you tell me the course of the cranial nerve in the flow chart? Yeah, the thing is the lateral to the lateral or gluteal in between olive and pyramid, right? After that, it's come out through the hypoglossal canal. Yeah, after that, it's anterior to the external carotid artery and the internal carotid artery, and also loop of the lingual, and it's what superficial to the hypoglossal muscles, and then it's applying to the muscles of the tongue. This is what the things. Okay, so this is the actual things, right? And where is the 11th cranial nerve? Yeah, here is the only 11th cranial nerve. This is the 11th cranial nerve. And where is the 10th cranial nerve? Yeah, obviously here is the, and see, this is the inferior ganglion, and this is the 10th cranial nerve. Okay, yeah, so it's see 11th cranial nerve joining the 10th cranial nerve, right? That's what I told you, right? And after that, it's supplying to the, I'm talking about 11th cranial nerve. It's joining the 10th cranial nerve, and after it's supplying to the muscles of the pharynx and the larynx, right? And somewhat here is the 9th cranial nerve. Okay, so here is the inferior ganglion, and here is the superior ganglion, and then it runs anterior to the internal carotid artery that we have seen, right? So this is the exact, right? That's why this all 4 are the closely related with each other. Okay, so this is the actual thing. Now what actually happened? You know the course. Okay, one more things I want to tell you that I want to rough these things, and what actually happened from here. From here, one now fibers from the C1 also joining this things, and it's come out with the hypoglossal canal. This is the 12th cranial nerve. It's supplying to the tongue. So same diagram only. Let me draw here. Here is the tongue. It's supplying to the tongue, and here is the one muscles that is called what? Genioglossus muscles. and that is the safety muscles of the tongue. Yeah, very good. And here is the hyoid bone, and here is the one muscles, and that is called what? Geniohyoid muscles, right? So geniohyoid muscles, am I right? And this is the hyoid bone, and here I think it's visible. Okay, here maybe the thyroid cartilage, right? Here is one muscles, and that is called what? Thyroid muscles, am I right? Thyroid muscles. Yeah. So what happening? The C1 fibers runs along with this hypoglossal nerve, and it's supplying the two structure. That is, one is the genioglossus and second is the thyroid muscles. Okay, with this 12th cranial nerve only. Through this 12th cranial nerve, C1 fibers, meningeal branch or meningeal fibers from the C1s, it's supplying to the two structure. One is the geniohyoid and second is the thyroid muscles. Okay, why I am telling this thyroid muscles? Why I am explaining these things? Because when there is the lesion in the 12th cranial nerve, which structures, which muscles will be gone? This will gone. Okay, in the affected side, thyroid muscles. Okay, so larynx will move which sides? I will tell you everything. Okay, every single point is the important, and it's applying to the geniohyoid. Okay, now tell me. So this is the things. Okay, and tell me from here. Fibers from C1 and C2, C3, this all will join together and it will come down, and some fiber will come down from here, and you know what I am drawing? Yeah, ansa cervicalis. Okay, the thing is that I am drawing the ansa cervicalis. Okay, so it's like this only. No, now tell me one thing. If there is 12th nerve lesions, what will be the symptoms? Tongue deviated to which sides? Affected sides or opposite sides, or larynx move in the same side or opposite side? Okay, let me explain one by one. See this genioglossus is the safety muscles of the tongue. Why it's safety muscles of the tongue? Yeah, because this is the only muscles which is responsible for the protrusion of the tongue. What will happen if there is no genioglossus? Tongue will fall down into the where? Oropharynx. Am I right? Yes. So this is genioglossus. Now this genioglossus is responsible for the protrusion. So see, for example, this is my tongue. Okay. Now I want to protrude my tongue. So how the movement will occur? Like this. Okay. Here is the midline structures, and from right side and from left side, both sides from muscles will come. Muscles will come forwards, and tongue will move medially upward. Forwards like this. So this is the exact protrusion occurs, right? And which is done by genioglossus. Okay, no problem. Now, if there is 12th nerve paralysis, if nerve is cut, so suppose right side there is now lesions. So what will happen? In now during the protrusion time, left side is everything is the normal. So left side muscles, the genioglossus will protrude like this. Yes, but right side there is the lesion, so there is nothing, right? So this will be like this. So this tongue is protruding to which structure, which side? Right side is affected, and left side everything is normal, so it's moving like this. So tongue is deviated to this side, right side. Yeah. So in the case of 12th nerve lesions, what will happen? Tongue is deviated to the same side. Okay, tongue will deviate to the same side. And what happened? See, if there is 12 nerve lesions, okay. So, for example, now cut, right? So after this, fibers from the C1s cannot supply to the thyroid muscles and thyroid, right? Thyroid cartilage is here, hyoid is here. So larynx is moving up and down. So larynx is moving up and down, right? Now there is just the right side nerve lesions. What will happen? These muscles can't move, but these muscles will move. Okay, so one time question has been asked in the MBBS that if there is 12 nerve paralysis, okay, larynx will move which side? Paralysis in the right side, so thyroid muscles is not active. But in the opposite side, thyroid muscles is the active. So what will happen? Larynx will move which side? Opposite side only, right? So larynx will move opposite side. In the 12th nerve paralysis, larynx will move opposite side because of the because of the action of the geniohyoid, which is the function in the left side, and the tongue protrude to the deviated side. Okay, so this is the features of the palsy. Okay, so I hope you understood everything. So okay, about the 11th and the 12th cranial nerve. Okay, so I think I have covered everything, every single point. Okay, tongue deviated to the same side, paralysis of the this muscle, and everything. Ipsilateral atrophy of the tongue may be occurs, right? So I think you understood the functional column and everything. So, okay, in the see hypoglossal now no. So which nucleus? Hypoglossal nuclei will be there. See, if suppose this is the diagram. Okay, so what you have to do? Draw one nucleus here, and this is your 12th cranial nerve, right? 12th cranial nerve. Okay, so this is what hypoglossal nucleus. Okay, or nuclei, whatever. So this is the things. Okay, so nucleus, functional column, course, and the branches. Okay, so tell me one thing. The 11th now already we have read now, supplying to which structure? Yeah, palatoglossus in the tongue, and second thing is the muscles of the pharynx. All the muscles of the pharynx is supplied by accessory now only one, except only there is one. Okay, and muscles of the palate also supplying. Okay, and the intrinsic muscle of the larynx, that is by the 11th nerves, and by 12th only the muscles of the tongue. Okay, so thank you very much. Thank you.